in the interest of time, there is incisional hernia. You gotta, you can fix those laparoscopically. This is the case where we did the hysterectomy, and then look here, the abdomen was not closed, and the patient, the bowel was into the abdominal wall. So the absolute contraindications for laparoscopy are those that do not let us create pneumoperitoneum. Everything else is relatively, like training, experience, instruments, diffuse peritonitis, shock. For me, it's much easier to go in laparoscopically than really do the laparotomy. Do we have time or not for another?
You have time, go ahead.
Okay, so it's completely, yesterday Mahar and I talked about myomectomies, and I know that majority of you are reproductive endocrinologists, and I want to show you the technique that is very valuable for doing I do this laparoscopically assisted myomectomy, which is the procedure. See, this patient had a bunch of fibroids, small uterus, nothing special, but lots of fibroids, and she went into fertility. She was like 32 years old. So we figured first step is doing diagnostic laparoscopy, and we find, see, there are fibroids here, there, easily, we can easily kind of remove those laparoscopically, some of them, not all. So this one was like pedunculated, we put the loop on, we just coagulated the base. Then we took the laparoscopic myomectomy of other smaller fibroids. And the problem with these, she's an infertility patient, and you don't want, like better than me, generally studies show that over three fibroids may cause infertility. Then we go in the left upper, then we go in suprapubically, put the myoma screw into the fibroids, and then we go and pull the uterus up, basically. We make a small mini lap, and as you know, they say like more than 3 fibroids may cause infertility, so we just want to make sure that we so then we remove all of them. So we put the Alexis retractor, and now uterus is completely out, and we can basically palpate everything and look. So show of hands, what do you think, who thinks there were more than 5 fibroids in here? Okay, couple hands. More than 10? 1 hand, 2 hands. More than 15? No hands. Only, and I will show you. So we just now look here, and we're taking these fibroids out, and you can do it like in open surgery, except incision is much smaller, and then we completely close and look, 15 fibroids. So another very important thing is for decreasing blood loss is we go in and we do the uterine artery ligation, temporary ligation of the uterine artery. So we are here on the patient's left side. We find the ureter. Uterine artery is going to be above it. We just kind of expand it a little. I mean, this is very small, 1 centimeter incision. Then we're going to go and find the uterine artery on this side. I'm just trying to, yeah, here you will see the artery there. And see, this is the artery, the uterine artery, and this is the ureter. So we use these clips that we place the clips, and then the same thing we do that on the other side. At the end, we just pull the clip off, and the patients do great. So thank you very much for the opportunity. By teaching you, I learned a lot also.